Natural and home remedies for diverticulitis. Diverticulitis is a painful and upsetting disturbance in the digestive tract, a colon disease, which can be effectively treated with the diverticulitis diet. While some individuals experience constant discomfort, others experience diverticulitis that wanes, and then flares up. Diet and a variety of risk factors can increase your chances of suffering from diverticulitis, especially after the age of 40. What is diverticulitis? Diverticulitis is the infection of the small sacs of diverticula that line the digestive tract. Diverticula seldom cause problems, or severe discomfort, unless they become inflamed or infected, in which case, the diagnosis is diverticulitis. It is believed that 10% of Americans, over the age of 40, is affected by diverticular disease. The rate continues to increase through aging. In cases of a serious infection, antibiotics may be needed, in addition to a change in diet. Many people find relief by limiting flare-up foods, and focusing on foods that are easily digested. Think of diverticula as storage sacs of plaque, much like what can clog arteries, except they reside typically in the lower part of the large intestine. As with clogged arteries, it is important to first clear the area, and then continue with a healthy diet. Diverticula sacs can become blocked with fecal matter, allowing bacteria to build, resulting in an infection. As the sacs grow, they put an increasing amount of pressure on the walls of the intestine, leading to pain, gas, abdominal discomfort, and other diverticulitis symptoms. This pressure is increased during bowel movements. Be mindful that constipation is both a symptom and a contributing factor to worsening symptoms. Left untreated, infection and perforation may lead to scarring in the digestive tract, where scar tissue may cause a partial or complete blockage. This is why it is essential to make the necessary changes to help heal your digestive tract. Diverticulitis symptoms. In the early stages, mild diverticulitis symptoms can be treated with rest and the diverticulitis diet. Severe or recurring diverticulitis may eventually require surgery for relief. That is why it is essential to watch for warning signs, and start making dietary and lifestyle changes as soon as possible. If you are experiencing 2 or more of the following symptoms, you may have diverticulitis. Marked change in bowel habits. Severe abdominal pain. Cramping. Tenderness in the lower abdomen. Nausea. Alternating diarrhea and constipation. Fever and/or chills. Causes of diverticulitis. Today's typical Western diet often consists of highly processed foods, sugar, and unhealthy fats. This type of diet contributes to the development of diverticula and an infection. Eating a diet rich with fiber can help to prevent diverticulitis, and helps in the healing of the colon. In addition to a poor diet, there are other risk factors to consider. Aging. Obesity. Smoking. Prescription medications including opiates, steroids, and non-steroidal anti-inflammatories. Lack of regular aerobic exercise. All of these risk factors, combined with a diet lacking in necessary fiber, and high in animal fats, can lead to the development of marble-sized diverticula in the digestive tract. The resulting inflammation, infection, and leakage into the abdominal cavity is uncomfortable at best, and has the potential to cause serious complications. 3 natural steps to treat diverticulitis. Step 1, the healing diverticulitis diet. During a diverticulitis flare-up, or at first symptoms, it is important to help your digestive tract clean itself out, and begin to heal. Start by using my beef bone broth recipe. Eating bone broths made from beef, chicken, lamb and fish helps to heal leaky gut syndrome, improves joint health, boosts the immune system, and even helps to reduce cellulite, all while helping to heal the digestive tract. Bone broths with cooked vegetables and a little bit of meat provides essential nutrients your body needs, including calcium, magnesium, phosphorus, silicon, sulfur, and more, in an easily digested manner. You may add vegetables to your bone broth, including carrots, celery, and garlic, or for variation, you may add an egg poached in the broth. In addition, sip on warm ginger tea 2 to 3 times daily to help reduce inflammation and aid in digestion. Ginger is a healing food that helps your immune and digestive systems. For beef, the collagen in the bones breaks down into gelatin within about 48 hours, and for chicken it is about 24. You can make broth in less time, but to get the most out of the bones, I recommend making it in a crock pot closer to 48 hours. Gelatin has amazing curative properties and even helps individuals with food sensitivities and allergies tolerate these foods more easily. It also promotes probiotic balance, while breaking down proteins, making them easier to digest. The truth about probiotics and digestive problems is that they help to create a healthy environment in your belly. During this first phase of the diverticulitis diet, consume only clear bone broths, clear fresh juices, no pulp, and soothing ginger tea. Stage 2. Once the diverticulitis symptoms have eased, you can move on to stage 2 of the diverticulitis diet and introduce easily digestible foods including grated, steamed and then pureed fruits and vegetables, while still drinking ginger tea and bone broth soups. Juicing fresh organic fruits and vegetables can provide a boost of nutrients. Carrots, beets, grapes, apples, lettuce and watercress can be juiced and enjoyed during this stage. Avoid foods with tough skins and small seeds as they can accumulate in diverticular sacs. Stage 3. When your body has adapted to the foods in stage 2, start to add fiber-rich foods including raw fruits and vegetables, and unrefined grains, such as quinoa, black rice, fermented grains, or sprouted lentils. As your body starts to adapt, you can begin consuming about 25-35 grams of fiber each day, to help stave off any potential flare-ups, while your digestive tract heals. Add in some potatoes, sweet potatoes, root vegetables, then slowly try some non-processed grains, beans such as oats or lentils. Foods high in soluble fiber include oat bran, nuts, seeds, beans, lentils, barley, and peas. Insoluble fiber is found in foods including whole grains, wheat bran, and vegetables. Step 2. Supplements to treat diverticulitis. Slippery elm. Slippery elm used for centuries both externally and internally to soothe digestive problems and relieve coughs and sore throats. Aloe. Aloe, in a juice form, aids in digestion, helps to normalize pH levels, regularizes bowel processing, and encourages healthy digestive bacteria. It is important to avoid aloe vera juice with aloe latex, as it can cause severe stomach cramping and diarrhea. Licorice root. Licorice root lowers stomach acid levels, can relieve heartburn, and acts as a mild laxative to help clear your colon of waste. This root helps to increase bile, aiding in digestion, while lowering cholesterol levels. Take 100 mg daily when experiencing diverticulitis symptoms. Probiotics. Live probiotics should be added to the diet to help negate food sensitivities, and relieve digestive upset including constipation, gas, and bloating. Probiotics are healthy bacteria that traditionally line your digestive tract to combat infection. Step 3. Lifestyle changes necessary to treat diverticulitis. Diverticulitis requires more than just a healing diverticulitis diet, and supplements to aid in a healthy digestive tract. Digestion starts in the mouth. It is essential to thoroughly chew each bite of food, until it is nearly liquefied. The more you break down the food before it hits the stomach, the more ready nutrients are ready to be absorbed. Diverticulitis side effects. Sustained fever and or chills. Continued nausea and vomiting. Blood in stool. Severe pain in a localized area of the abdomen. Rectal bleeding. Signs of shock including feeling dizzy or weak. What to expect while healing. Diverticulitis is not healed overnight, it is a process that can take a couple of months. Be patient, and don't lose faith. Soon, you will start to enjoy your life again. Throughout the process, be sure to get plenty of rest, and manage stress. You may find yourself losing stubborn weight, and over time, energy levels will increase.